You know the pink ribbons and what they mean. Oftentimes we talk about breast cancer awareness during October, but really it's a topic with year-round importance. Like, did you know that recommendations for when to get a mammogram recently changed? Here to talk about mammograms and everything you need to know is Amanda Scarlett, a mammography supervisor at Norville Breast Center at Alamance Regional. All right, so first and foremost, let's just start off with kind of like the basics. Is a screening mammogram the same as a diagnostic mammogram?
So there is a difference between a screening mammogram and a diagnostic mammogram. A screening mammogram just means that you're not aware of any new concerns or any new breast problems. But a diagnostic mammogram means that you have felt something new. You have noticed changes to the shape of your breast or skin thickening. You have noticed nipple discharge. So these are all signs that you need a diagnostic mammogram. And diagnostic can also mean that the radiologist needs to see you back to further evaluate an area of concern or an area that has changed from your latest screening mammogram.
Okay, so the one that people are referring to when they say, hey, you need to get your mammogram is just the typical screening mammogram.
That's correct. So when you hear get your mammogram, we're talking about that yearly screening mammogram. So think of it as another preventative health maintenance test, just like going to the dentist every year or going to get a physical every year.
Okay, so who needs to have this screening mammogram and how often do they need to have it?
So we follow the same recommendations as the American Cancer Society and the American College of Radiology, and that's for women to start annual screenings at age 40. And sometimes it's even sooner based on a strong family history.
All right, so let's say you are within that age range and you've never had a mammogram, you need a screening mammogram. How do you go about getting an appointment? Like, you're thinking to yourself, is this a specialist? Do I need a referral? That kind of thing.
So some providers like OBGYNs or your primary care doctors, they actually will call and set up your appointment for you, but you can really just call any of our locations directly. And the process over the phone is typically about a 1 to 2 minute conversation. And if you don't have a primary care doctor or an OBGYN, then we can assist you in getting set up with one.
Okay, and there's lots of places to get a mammogram all in our area. So how do you choose a location to have your mammogram? Like, what should you be looking for?
So I would look for a facility that offers 3D imaging. I would also make sure that the radiologists are breast dedicated radiologists that are reading your mammogram. So that just means that these are the experts, these are the specialists. These doctors have gone through residency and fellowship and in just breast imaging. And so other things that I would look for is a facility that is certified through the FDA and accredited through the ACR, which is the American College of Radiology. That just means that they're producing high quality images, and you should be able to find this on a facility's website.
Yeah, that was about to say, that'd be my next follow-up is, okay, where do we find this? And when you look on the website, usually it lists all the doctors and things, and it lists all of those specialties.
Correct.
Okay. All right. So for someone who hasn't had a screening mammogram before, the unknown can certainly create some anxiety, right? You hear all kinds of things about machines that they use and that kind of stuff. So let's go over like the step-by-step. What should a woman expect when they go and get their mammogram?
So when you come in for your mammogram, you can expect the mammographer to go over step-by-step about what's about to take place. We will explain everything to you. We're going to walk you through it. Unfortunately, people have heard horror stories about a mammogram, but technology has changed. Things have come a long way, so it's a lot better than the way it used to be. When we are positioning you for the mammogram, it will be snug, because it's important that we have adequate compression and really spread out those breast tissue layers. We don't want to make sure there's nothing hiding in there. So we want to produce good quality images for the radiologist. And if at any point something is too painful or just unbearable, just communicate that to the technologist, because we'll walk you through it.
Yeah, it's more of an uncomfortable test than it is a hurtful test.
Right. It's snug and it's just for a few minutes. It does not last long at all.
And then one of the other tricks is what you should wear to the mammogram.
Correct. I would suggest that you wear a two-piece outfit. We have these nice little warm gowns that we put on you. That way we try to keep you somewhat covered up as much as possible and just focus on one breast at a time.
Okay, we're going to take a quick break, but we're going to continue on this conversation so that we can talk about mammography and breast cancer as well, so that you can have all the information that you need. We'll be back in just a few minutes. Well, welcome back. Amanda Scarlett, mammography supervisor at Norville Breast Center at Alamance Regional, is with us today. We're talking about all kinds of mammogram issues. All right, so what are some of those common myths about mammograms that you'd really like to set the record straight on?
So Tanya, I want to talk about 2D versus 3D imaging. So at our facility, 3D imaging is the standard of care, but no matter where you go, I would definitely confirm that that's what you're getting. So with 2D imaging, we are just capturing a single image of the breast. With 3D imaging, we're actually taking quick pictures at different angles. And by doing this, the radiologist is able to scan through those breast tissue layers in millimeter slices. So they're getting more information. This is really important for women who have dense breast tissue. I like to use my little bread analogy, Tanya. So when I'm explaining this to my patients, say for instance with 2D imaging, you just have a loaf of bread. With 3D imaging, you still have that loaf of bread, but you're actually able to peel back all those bread slices and take a closer look at each layer.
Right, and you want to make sure that you're getting all of the images for that. Now, 3D became a big deal for women who had dense breast tissue. I'm glad that it's something that everybody's getting for the most part, but what is dense breast tissue?
So every woman has a different mixture of fatty breast tissue and the dense fibroglandular tissue. So some women have more of the fatty, some have more of the dense breast tissue. So it's just part of our genetic makeup, but everybody has a little bit of different mixture.
Okay. All right. So some people may say, you know what, I don't have a family history of breast cancer, so I really don't need a mammogram every year.
The majority of women who are diagnosed do not have a family history of breast cancer, so it's still really important to get that mammogram every year.
All right, and here's another myth. You only need to get a mammogram if you're experiencing breast issues.
So this is not true. Whether you are experiencing breast issues or not, we still recommend that you come in and get that mammogram every year. So the goal is really to catch breast cancer at its earliest, most treatable stage. We don't want to give cancer time to grow. And so a mammogram can actually show early changes and early signs well before a woman actually would feel a new lump.
Okay. Now, for some people who are concerned about the cost or are unable to afford getting a mammogram, they might put it off. How concerning is that?
So this is very concerning, but at Cone Health, we do have some options. Mammograms are important for all women to receive. So for those who are uninsured or underinsured, we do have some programs that can help those women gain access. And so more information about that is on our website, and there are qualifications that do apply. Or you could call us directly, and we'll be happy to talk to patients about that.
All right, where can people go to learn more about mammography services at Cone Health and just the importance of making that appointment and making a timely appointment?
Yes, so more information is online about our services and all of our imaging locations at conehealth.com/mammograms.
All right, and just one last thing. If people are thinking to themselves, you know, it's just such a hassle to make doctor's appointments these days and this, that, and the other, and they'll be like, I'm fine, maybe I'll get it next year, what would you tell them?
So, mammograms are pretty quick. The exam itself takes 10 to 15 minutes. So grab your girlfriends, come in, make it a date, get your mammogram done, hold each other accountable, and then go grab some lunch. We try to keep it hassle-free from the scheduling process over the phone to the day that you come in, so you can get back to your day.
All right, and let's go over the recommendations just real quickly. Once again, how often do we need a mammogram and at what ages?
So again, we follow the same recommendations as the American Cancer Society and the ACR, which is annual screening starting by age 40, so every year, and even earlier based on a strong family history.